A very warm welcome to our podcast series, Health Frontier Insights from Global Experts. We are back with another episode, Equity and Economics Leading Healthcare Forward, where we dwell into the intersection of economics and healthcare leadership. I'm your host, Dr. Rishrita, and today we have a distinguished guest with us, Dr. Shankar Prinja. He's a professor at PGI Chandigarh and an expert in health economics. Welcome to the show, sir.
Thank you.
So, my first question to you is that as a leader in the field of health economics, do you integrate economic principles into your leadership approach to influence policy and decision making in public health?
Sure. Thank you very much. And so I think that if I have to say that is there any kind of an application of economics into decision making, I would like the people who are working in either policy making or program decision making to reflect on what is the broad nature of pressing question that they're always posed, or what is the kind of accountability metrics for them in their routine health services. So I'm sure that for most of the participants also who are here in this workshop, the major question that they're always asked in terms of in terms of monitoring their progress is what is the coverage of services. Whether you are a public health program manager, you are asked what's the coverage of your measles vaccination, what's the coverage of your vaccinations program, what's the coverage of your institutional deliveries, antenatal coverage, etc. And if I say that what is it that is going to influence the coverage or the utilization of services, the factors that are going to influence the utilization of services is nothing but demand side factors and supply side factors. And what economics tells you is that how do you influence, or how do you perhaps change some of those or address some of those demand side and supply side factors that eventually are likely to impact on the utilization. And if I look at it in the sense that what are the major interventions that are being done across countries for influencing the utilization of healthcare services, then majority of the interventions are things that are ultimately impacting either of the demand or supply side factors. So, for example, I'll just take a few examples. You have things like insurance programs coming up in countries, publicly funded, government-funded insurance programs. Now, what are these government-funded insurance programs trying to do eventually? In a very plain talk, you say they give you cashless services. But from an economics lens, basically you are saying they make the price at the point of service equals to zero. Or they make the price of the healthcare service utilization highly subsidized. So eventually you are influencing the price. And our entire knowledge on microeconomics tells us that as you decrease the price, there is going to be a greater demand for healthcare services. There are other examples, conditional cash transfers. You give cash to people who are coming to access healthcare services. So any service that you want to promote, you give some kind of a cash incentive, you give some kind of vouchers, etc. to people. These are all interventions that are impacting the demand side. On the supply side, various interventions that you are trying to do by increasing the human resources, increasing the availability of drugs, etc. These are all impacting your supply of healthcare services. So all interventions that are being done in the space of public health, practically speaking, to impact on utilization, are all, their underpinnings are linked to basic principles of microeconomics. All decisions around resource allocation in order to maximize their health benefits are grounded within the fundamentals of cost effectiveness. So if you are taking economics out of your decision making, you are actually making wrong decisions.
Sir, You have conducted extensive research and cost effectiveness analysis, as you said. Can you discuss a specific project where your findings significantly impacted public health policy or healthcare delivery in India?
Right. So I think there are several examples of such nature where evidence and research undertaken on cost effectiveness has resulted in significant policy uptake. One of the major uh, examples that I'd like to cite is that the entire so we have a large insurance program in India, which is the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. It is an insurance program that covers 500 million Indian population. Uh, there's a health benefit package that comprises of nearly 2,000 interventions, services, or medical procedures that are provided to people. The most important critical part in that health benefit package is how much do you pay the providers. A very large body of our research, which has focused on cost of healthcare services, has significantly influenced the decisions around pricing within this insurance program. So, several revisions in the prices that have been undertaken in the health benefit package of PMJY has benefited from the research that we have undertaken. But it's not to say that again this research to evidence transfer is a linear process, that whatever cost estimate that you generate is directly taken as the price point. No, there is a significant deliberation that also takes place, a stakeholder consultation that also considers many other aspects, that how pricing is eventually going to drive the provider behavior. And that may mean that while your cost input becomes one of the parameters for decision making, there are a whole range of other factors that are also considered in pricing. But then there are many other studies also, but in the interest of time, maybe I'll skip that.
Sir, given your expertise in healthcare financing, what strategies do you advocate for ensuring sustainable and equitable financing of healthcare systems, particularly in low and middle income countries?
Right. So I think that for all of us who are engaged in the business of financing healthcare, there is very well established evidence now that in order to achieve universal health coverage, which is one of the fundamental goals of sustainable development goals, the strategy for achieving universal access with adequate financial risk protection is tax based funding. Among the different mechanisms of financing healthcare, the only method that has sustainably been able to produce uh, results or achieve universal health coverage has been tax funding. In some of the developed countries, even social insurance based systems have also successfully functioned. But the problem in many of the low income countries is that people in low income countries, large majority of the workforce is also in the informal sector, and which means that collecting mandatory contributions from them for a health insurance which becomes part of a social insurance program is sometimes very difficult. So inevitably you end up taking using tax money or the tax revenue to finance healthcare services.
And sir, you are developing an online course in health economics for healthcare professionals. What leadership qualities do you believe are essential for effectively educating and engaging students in this specialized field?
So I'll first make corrections in this question. First, we are not developing. It's a course that has been developed more than a decade ago. It has trained several thousand people. So it's a very well functioning developed course. The second correction is I am not the fit expert to respond on leadership qualities. The best person in our country to comment on leadership qualities is Professor Sonu Goyal, who is a professor of health management in our Department of Community Medicine and School of Public Health in PGI. I'll rather pass on this question to him to respond. But still, since you have asked me that what would be the kind of leadership qualities for you said.
Yes, sir. For the upcoming people who want to pursue this specialization.
Okay. So I'll say that by and large, in these courses that we run, even in terms of backgrounds, we generally make it very broad based. The eligibility to or the people who possibly could benefit from these courses, we do not necessarily restrict it to people with only a medical background or people with only an economics background. We would say that anybody who's currently working in healthcare, anybody who's working in healthcare, be it in public health, whose engagement is with public health programs or in insurance related activities, or in even in the private sector industry also, there is a very strong requirement for them to at least have the basic knowledge and skills related to economics, so that the delivery of the healthcare programs that they are aiming at are also of reasonably good quality and they are able to achieve the broader health system goals. And in that sense, so what I'm trying to say is that there's a very broad based entry requirement to this course. And by and large, I think that these are meant for people who are involved in very large different variety of decision making roles, both at senior level policy making, at mid level decision making for program management, etc. also, and also at the micro level, which means people who are managing healthcare facilities, because a lot of healthcare program decision making actually takes place at the level of facility. So the person in charge at the primary health center is perhaps, in my opinion, or a or a district program manager is perhaps the most vital to the success of the program. You know, as they say in India, they say one of the very famous quotes is that there are three people who are the most important in any kind of governance structures. And they say who those three people are. They are the DM, the CM, and the PM. Okay, so the DM is the district magistrate, the person who is in charge at the district level. CM is the political head of a state in this federal structure, and PM is the prime minister of our country. They're the three most important people. So leadership is at all these three levels, and same is the case in case of healthcare as well. So even at a primary health center, the one who is running the primary health center, the medical officer in charge, is a very, very important person. But again, as I said, there's a caveat in my response. The best person to answer this question is Professor Sonu Goyal.
Thank you so much, sir. Is there any message you'd like to give, a motivational message to our audience who's going to look at a podcast?
I think I've thoroughly enjoyed the interaction, as much as perhaps, hopefully, I would have been able to deliver some message to them. I think I gained a lot from the nature of questions and the extremely participatory nature and I think the rich experience that comes as part of such a diverse set of participants coming from so many countries. I think that itself is the most rich part of this entire training program that Professor Goyal has been organizing since now several years now.
Thank you. Thank you so much, sir. Thank you, sir, for sharing your insights and your experiences with us. And to our listeners, thank you for tuning in, and stay tuned for more episodes. Till then, stay informed, stay healthy. Thank you.